Welcome to the deep dive. Today we're exploring a really crucial link, the one between big environmental changes happening globally and, well, our health. The big question we're tackling is, are the doctors of tomorrow actually being prepared for this? Especially now we're in this era, the Anthropocene, where, human actions are changing everything.
Yeah, and the scale of the problem is,
Mm.
it's immense. It's not some far-off thing either. Right now, you have direct impacts, things like extreme heat waves, really severe weather events. These lead directly to injuries, even premature deaths, and hits vulnerable groups hardest, young kids, older adults.
Hmm.
And that's just the direct stuff. Then you've got the indirect effects impacting food supplies, water safety, air quality, even where infectious diseases are popping up. The World Health Organization has a conservative one, mind you, estimating about 250,000 extra deaths each year by 2030, all linked to climate change.
250,000 additional deaths.
Yeah.
That's really stark. It really hammers home how serious this is. And it makes you think, okay, if major health players like the Lancet, the AMA, they've recognized this for years, they've made commitments, so what's actually happening on the ground in the medical schools?
Well, that's where you see this surprising gap, honestly.
Hmm.
Despite all that high-level recognition, those pledges, medical school teaching hasn't really caught up. For example, if you search the AAMC database, that's the Association of American Medical Colleges, where schools report what they teach, well, there was no explicit mention of climate change education in the curricula reported there.
Wow, no explicit mention. That seems like a pretty big blind spot, doesn't it? Especially when the global health world is shouting about it. So why?
Right.
Why the lag? Especially because today's medical students, this generation, they have a huge stake in this. Like, what is it? 17 of the 18 hottest years recorded since 1880 happened since 2000. This is their world.
Exactly. It's their reality. And the reasons for integrating this now are, well, there are several really strong ones. First, the sheer scope of the health problems. Think about air pollution, just one piece. It was linked to maybe 6.5 million deaths back in 2015. Climate change makes that worse.
Right.
Second, the healthcare system itself, particularly in the U.S., has a massive carbon footprint. We're talking maybe 9 to 10% of national greenhouse gas emissions annually.
10%? That's huge.
It is. If U.S. healthcare were a country, its emissions would rank it 13th in the world.
Yeah.
So doctors have a responsibility there, both ethically and practically within their own workplaces.
Okay.
And third, bringing climate change into the curriculum actually builds really vital skills for doctors. Critical thinking, looking at problems from multiple angles, understanding public health. It strengthens all that. Like knowing how climate shifts disease patterns. That directly helps with diagnosis, with advising patients.
Okay, so it's clearly important, impacts tons of areas. It even develops core physician skills. So how, practically, do medical schools fit this complex topic into what's already, let's be honest, a jam-packed curriculum? It sounds tough.
It does sound daunting, but it's definitely feasible. The key is integration, not necessarily adding whole new separate courses. Look at Georgetown University's medical school. They have an asthma module for their third-year students, right?
Mm-hmm.
Now, they've integrated a climate change component within that existing module. It connects the dots between air pollution, climate factors, and asthma. Helps students advise patients better.
So embedding it into relevant existing topics.
Exactly. It shows how you can use climate-relevant examples to enrich the discussions they're already having without needing massive amounts of extra time dedicated just to climate.
That makes sense. So the real takeaway here isn't just about learning a new list of risk factors. It's more fundamental. It's about preparing future doctors to see health through a new lens, understanding how illness itself is being shaped by our changing planet. It's just the reality they'll be practicing in.
Precisely. And maybe a final thought for you to consider is this. What does it really mean for any physician to be considered well-informed in this century if their training doesn't equip them to understand the planet's profound, undeniable influence on the health of every single patient they'll ever see?